Hello, ladies and gentlemen. My name is Brian Wright, CEO of New Patient Group. I want to talk to you today about effective strategies in order to improve the communication at your practice. And today we're going to talk about effective frequency. And we talk a lot about consumer tendencies, the biology of the brain, things that are scientific fact in order to improve things throughout your dental practice or orthodontic practice. And today, effective frequency is a huge one. This is a very big portion of our program. And what is effective frequency? Well, looking up on the screen, effective frequency is a scientific fact, and it's based on the biology of the brain. It's also utilized as a marketing term. Now, what it simply means is how many times the consumer, the average consumer, needs to hear a message in order to act, purchase, and refer to your business at high levels. And effective frequency also refers to the way a consumer must hear a message. So it's not just the amount of times a consumer needs to hear a message, it's how they are hearing that message. So you possibly could say something in a specific way to a consumer, and because of the way you're saying it, you may get them to act in 1, 2, or 3 times saying it. I may say that same message that you do, but I may communicate it in a different way, and it may take 10 to 20 times for that particular consumer to make a decision. Now, the average time a consumer needs to hear a message in order to act at high levels is 20. And you heard that number right. That number is 20. That's a study not done by us, but large corporations across America. They track that stuff, whether it be in their sales division, marketing division, etc., on how many times they need to play a commercial, how many times they need to follow up with a prospective client, whatever it may be. Effective frequency refers to how many times a consumer needs to hear a message, and that can be upwards of 20 times. Now, studies have also been done that say effective frequency can relate to a consumer hearing a message as low as 4 times in acting. But again, it's very much pertaining to how you are communicating that message. So let's dive in. How does effective frequency apply to your practice? Why does it matter? Now, there are 4 types of communication that occur every day at your practice. There's probably arguably more, but for sure at every single practice, these 4 at minimum, every practice has in common. And that's you as the doctor communicating to both your patients and your staff. And then it's your staff communicating to patients and then also to each other. Those are the 4 types. Now, every single person at your practice, including you, and sometimes this is forgotten not only by you, but just people in general, is that each one of you are a consumer. All right, you have buying tendencies, you have motivational patterns, behavioral patterns, etc., that every other type of consumer has in some form or fashion. All 4 types of communication, because of this, are extremely important, because all of them you have to achieve effective frequency to maximize and improve the communication that consistently takes place at your practice every day. The very first one that I want to talk to you about is how you are communicating to your patients, doctor to patient communication. It is a fact based on biology, not the stuff, not our opinion, but if you start looking at biology terms, scarcity, effective frequency, etc., the verbiage that is taught in dental school does not achieve any of those, and especially effective frequency. And in fact, much of the verbiage that dentists utilize actually reinforce the reasons consumers do not understand and value their treatment plan. Again, in other videos we've done, Dental Economics does the study that only 50% of consumers visit a dentist in any one calendar year. We believe the reason for that is consumers do not value dentistry the way they should. Now, the reason for that is that the people within dentistry are reinforcing the negative beliefs consumers have of dentistry by how they communicate the treatment plans, the problems in the mouth, etc., to the consumer or otherwise the patient. Now, the verbiage dentists actually utilize, the verbiage that you utilize is actually the opposite of what engages consumers to say yes. We have multiple examples in our program that prove this to be true, and it actually does the opposite of what it is you are wanting. Now, as a doctor, you are placed in a position to communicate effectively and at very high levels on a daily basis. And most doctors do not have the commercial training to know how to do it. And that is not a criticism whatsoever. You go to dental school, then all of a sudden you're thrown into being a business owner and a CEO. And there's a lot of things that you have to do every single day that's non-clinical that most doctors do not have high-level commercial training. And again, not a criticism. That doesn't show a sign of weakness on your part or anything. What it simply means is that you need to consistently be getting that training in order to maximize the amount of money that you put in your pocket over the course of your career. The next one is how you communicate with your staff. Whether you like it or not, staff members are consumers and they need to hear things said in a very specific way and a certain amount of time, if you expect them to do their jobs at the highest levels possible. Whether you like that, you hate that, or you're somewhere in between, it is a fact that that's true because it goes back to effective frequency. Not only the amount of times that you communicate the message, but how you communicate the message. It's a combination, and both of those are put together are very powerful. Now, great CEOs constantly learn new ways to better communicate with employees. It's an ever-going training and knowledge because it's not easy, because also great CEOs constantly are learning new ways to motivate and lead their team. That is not something that comes easily. There are people that train for years on it and still are not good at it. It is something that takes a lot of training, a lot of studying, and a lot of practicing. And the facts are, you are a CEO first. You went to school to be a clinician, I understand, but the facts are you are a business owner. And if you're listening and you just happen to not own your practice, you're an associate, a lot of this applies to you as well from a communication standpoint. But if you are the CEO, if you are the owner of your practice, you need to act like a high-level CEO, a Steve Jobs, a Bill Gates, etc. first before a clinician. Doesn't mean to diminish your clinical skills whatsoever. It's just to put you in an understanding that you are a business owner that happens to be a clinician. You are not a clinician that happens to be a business owner. This is something that's extremely important because if you take the CEO mindset first, you always will outproduce and put more money in your pocketbook as compared to your competition. Think and act like a high-level CEO first. Now, the next one is staff to patient communication. Commercial organizations train their employees how to better communicate with their clientele on an ever-going, ongoing basis. The training never stops. Every day you wake up to constantly improve yourself, push yourself to the limits, constantly trying to learn something new. Communicating with your clientele, in this case you call your clientele patients, is extremely, extremely difficult and takes high-level training. So it's very important because the question we always ask is why do commercial organizations train their employees this way, but healthcare organizations don't? They're both commercial. Your staff, whether they're communicating something clinical or something else to a patient, that's commercial. Anytime you're in somebody's mouth or setting up a tray, that's clinical. But when you're talking about the clinical, that's actually a commercial skill because you have to be able to say it in a way that the consumer understands. So it's the same way with you, same way with your staff. They have to be trained on high-level commercial communication skills in order to maximize your success. Now, hygienists, dental assistants, ortho assistants, they must properly communicate to patients every day. And like I said, they do not have the commercial training to know how to do it. So therefore, what happens is that they just do it however they believe needs to be done. And that's an ongoing problem in healthcare because you have people doing it the way they think should be done, but they don't really have the training to know whether or not that is the way it should be done. Now, the next thing is the front desk, treatment coordinators, insurance experts, etc. must also properly communicate to clientele, potential clientele, consumers that are calling your practice. Your receptionist answers the phone and they ask a price question, and bam, now your front desk is in a position they have to overcome it. How are they trained? Did they go to school to learn scripts? Have they worked in a call center before? If they haven't, why do you trust them to answer your phones? All of that requires high-level training. All of this presents a serious problem in healthcare because staff does not come with the commercial training necessary to communicate to your clientele, which you call patients, at a level high enough to ensure your success. Now, the next one is staff-to-staff communication. Effective frequency very much applies to them just as much as it does you. How is your staff talking to each other? What are they communicating? How do they communicate it? Do they understand the personalities in the office? Does the front talk to the back in a certain way and vice versa? All of this relates back to effective frequency. How your staff communicates messages with each other. Are they communicating in a way that drives behavior? How are they? What is their tone, etc.? Is your staff trained at the high level on how inter-office communication skills work? Are they trained on that? If the answer is no, then you do not have your communication where it needs to be. Doesn't mean that anything I'm talking about, it doesn't mean that your practice stinks or you're not great at it or whatever. Not what I'm saying. What I'm saying is it is a fact based on science that effective frequency needs to be implemented into your organization in order for you to maximize your communication success. Again, doesn't mean that your communication's bad now, but that also doesn't mean, and don't trick yourself into thinking, well, that doesn't seem to be a problem for us. Understand that regardless of whether you identify it as a problem or not, it still can improve. And that's where we look at communication as a separate business within your business, just like we do everything else, is that everything in your business, no matter how good it is, or no matter how bad it is, or somewhere in between, can still improve at all times. It's an ongoing, ever-going pursuit of perfection in order to maximize your dental practice success. Appreciate you listening today. Anything we can ever do for you, please let us know. Again, my name's Brian Wright, CEO of New Patient Group. Thanks for checking in today, and we'll talk to you soon.